In my previous post, I suggested ways to stay healthy to avoid high healthcare costs independent of the political turmoil. But even the biggest health junkies can be dealt a bad hand and some nasty bills. America streamlines healthcare to be readily available, quick, and efficient. There is little incentive to make it affordable for the maximum number of people, and it shows. America pays far more than other countries with similar or better life expectancy. So how might regular folks save money on future treatments? Private insurance and healthcare providers are billion-dollar companies with fiduciary responsibilities to their shareholders to maximize profit, not minimize costs. Citizens pay into an insurance pool that helps to pay providers for treatments. Providers keep costs high for higher margins and to encourage paying for insurance premiums, which in turn increase for more profit for insurance companies. Taxpayers also fund public pools for poorer and older Americans who can't afford insurance, but the private companies still dictate the extravagant prices. Some tout the free market as a panacea, but the market is amoral. The current domestic market yields maximum profit when some can't have adequate access to healthcare. But if healthcare was a true free market, shouldn't it be borderless? I mean, this isn't North Korea. Americans can have access to any healthcare provider in the world, well, except for maybe North Korea. Without adequate coverage, you're often choosing between your house and your well-being, so why not shop around? Medical tourism destinations are often situated in warm tropical locations that are sure to provide a morale boost on top of better prices. Just look at the prices for some procedures around the world. You'd save money abroad for every one, not to mention on consultations, examinations, and prescriptions. A plane ticket from New York to Cancun costs $500, and a cheap hotel is $100 a night, so any treatment costing thousands of dollars could be worth the trip. Medical tourism is currently an individual out-of-pocket undertaking. But what if that changed? Would it be more effective to localize insurance pools and socialize the risk among those around you? We already organize charities and crowdfunded donations for those in need, so why not institutionalize it a bit? Let Americans lend a hand to their fellow neighbors through grassroots organizations and memberships that strengthen communities. Instead of paying faceless multinationals your hard-earned cash for local treatments, why not pool your money locally and spend it on the cheapest treatment option available, wherever it might be? Local insurance groups have more incentive to look after each other, and the participants are held more accountable for maintaining healthy habits. As long as it doesn't become the Stasi, a little nosiness doesn't hurt, right? So next time, maybe you won't supersize the meal, or maybe you'll skip happy hour, and maybe you don't spend all weekend on your couch. When it's literally your money helping those around you, you go the extra mile to make sure they get better and stay better, even if it's out of selfishness. So where does your money go? Well, once it's been pulled together and someone requires treatment, the group can administer solutions based on the recommendations of an associate or an independent local physician. Based on the treatment and associate costs, the patient begins consulting with the appropriate offshore medical facility, then books the procedure, transportation, and accommodations. The patient travels there when required, receives treatment and medication, and stays for an appropriate amount of time to recover before returning to loved ones. Regular online checkups and return physical examinations will be performed as needed. In time, international healthcare providers will optimize the end-user experience to attract more patients and to compete with each other for your dollars. Flights and accommodations will be bundled together and booked by providers and revolve around the patient's schedule. Physicians stateside will develop working relationships with specialists abroad, streamlining the pre- and post-treatment process. Flights can also be optimized to allow groups of patients to fly together, help each other out, and relax and recover in good company. There are already consolidated medical villages in various scenic destinations. They will only further expand their services to provide convenient one-stop-shop experiences for weary foreign patients, so long as America refuses to rein in skyrocketing costs. Perhaps one day you'll be able to get off the plane, go to the doctor and get worked on, relax and recover, and head home when appropriate, all with a few swipes and calls, and it won't be considered weird at all. We think of outsourcing as hollowing out the livelihood of hardworking everyday people, but protecting the healthcare industry only serves to enrich a few insurance execs and medical professionals. Surely the out-of-work coal miner with black lung deserves more sympathy. Nobody gets everything locally anymore, so why should healthcare be any different? If you truly care about your community, why not band together, help each other out, and purchase the most cost-effective health treatments available? It's a strange marriage of grassroots action and global free trade, but it's worth a shot. Let me know what you think.